Hey, welcome back to Boondock Medicine, folks. Today we're going to talk about burns. I don't know many people who haven't been burned by something during the course of their life. Could be as simple as a sunburn or as serious as a full thickness burn. But they are a painful fact of life. What all burns require is prompt medical treatment. Remember, the skin is an organ of your body. It's the biggest one. Skin damage by burn is measured by degree of severity. First degree burn typically only involves the epidermis or the surface of the skin, producing redness and pain. We've all had that. You touch a pot or your kettle typically produces that. In second degree burns, the injury extends to the dermis to produce swelling, pain, and blisters. And some of us have had that too. Even a sunburn can give you blisters. That's a second. You get a sunburn and you have blisters, that's a second degree burn. Okay? You have burned yourself really well. Full thickness burns, or third degree burns, destroy all or most of the layers of the skin, impairing nerves. Although the surrounding tissue is painful, the burned area will appear white or charred. People who have full thickness burns, I remember a couple coming into the ER, and they had been trying to light their furnace. The furnace blew up, and they had full thickness burns. They couldn't even feel, which I guess is a good thing, the charred part, because the nerves were all burnt and dead. So white and charred, remember that, white and charred, full thickness. You're in trouble. If you have a full thickness burn, you're in trouble. You need to call 911, or somebody needs to call 911 and get you to the ER stat. First and second degree burns no bigger than the palm of your hand can be treated by immersing the injured area in cold water or by applying a cold compress. You should have cold compresses around. Do not apply ice cubes directly to the wound, but you can put them in the water that you are putting your affected limb in, and continue for about 10 minutes. Finally, if your second degree burn is in a large or sensitive area, or you have incurred a full thickness burns, go to the ER, as I said, or call 911. You may cut away clothing that is over the burn unless it's adhered to the burn. Please don't rip your clothing out of the burn. That'll make it twice as bad and can get it infected also. You can loosely cover the wound with a sterile or non-adhesive dressing. Do not apply anything else, not even water, to the injury. This is a third degree burn now. To prevent edema or swelling to the extremities, you may elevate the affected limb. Full thickness burns are a medical emergency. Do not screw around. Get medical help ASAP. Okay? Supplements. This is after the burn that you can take to help heal your skin. Beta-carotene, 25,000 international units per day. Potassium's great. 4,000 milligrams per day. Potassium's great for burns. Vitamin A, 100,000 international units per day for 1 month, and then you bring it down to about 50,000 international units per day. Vitamin B complex, again, another good vitamin, 100 milligrams. Remember, vitamin B complex you have to take with food. It can upset your stomach if you don't take it with food. Vitamin B12, 1,000 micromilligrams twice a day. Vitamin C, 10,000 milligrams per day. And then you take that immediately, and then 3,000, back it down to 3,000 after a couple days. Vitamin D, 1,000 to 5,000 international units every day. Vitamin E, 6,000 or 600 to 1,600 international units per day. And zinc, 30 milligrams per day, which is great. All these supplements you can take to help heal burns. The herbal remedies include aloe, the gel from the inside of the plant's leaves, reduce inflammation, soothes burn pain, fights bacteria, and speeds healing. Believe it or not, that little plant that you break off and the gooey stuff comes out, it does all that naturally. You'll find aloe in many professional kitchens. Chefs keep them around. for minor burns and scalds. They know what they're doing there. They get scalded and burned all the time. Lavender. The essential oil of this flower relieves pain and enhances the healing of burns. Unlike most other essential oils, you may apply this oil undiluted directly to the skin. Undiluted lavender, right to the skin. Tea, both green and black tea, are rich in antioxidants and cooling to sunburns. The sun's ultraviolet rays produce free radicals in the skin. The tea's antioxidants can remove these free radicals to help prevent tissue damage. Just apply a wet, cool tea bag to your burn. That's it. Cool tea bag, please. Not hot. Witch hazel. If you're older than dirt like me, you remember your grandmother's remedy for everything was witch hazel. I always hated the smell, but the stuff works. It is extracted from the bark of a tree and works as an astringent, bacteriostatic agent, which means bacteriostatic means it prevents bacteria from what? Replicating. That's right. It decreases inflammation and soothes the burns. So witch hazel, get some witch hazel, slam it in your medicine cabinet. The stuff's, a lot of people think the stuff smells good. I think it smells like hell. But it is great stuff. It's great astringent. Remember, if you have questions about any of our videos, you can reach us at boondockmedicine@gmail.com, and I'll answer any and all your inquiries. Thanks for tuning in. And if you like what we do, please subscribe. This is Doc signing out. Be well. AMF.